Welcome to the deep dive. Today, we're venturing into a really interesting area, the balance of electrolytes in our dogs and cats, specifically. We're focusing on hypophosphatemia, basically, when phosphorus levels in the blood drop too low.
Mm.
Now, it might sound super specific, maybe a bit niche,
Yeah, it does sound technical.
but as we'll see, it actually sheds light on some really fundamental processes that keep their bodies ticking over.
Absolutely. Phosphorus is what's a real workhorse, at the cellular level. It's structural, it's energy.
Right.
So when those levels drop, it can cause sort of ripple effects through the whole system. Our aim today is to define it, sure, but also to really get into why it happens and what it means for the animal.
And we're basing this on a pretty detailed veterinary resource, yeah.
That's right, a comprehensive guide for this exploration.
Okay, let's jump right in. Hypophosphatemia. Break it down for us. What are we actually talking about in simple terms?
Okay, so essentially it means the phosphorus concentration in the serum, that's the liquid part of the blood, drops below 2.5 milligrams per deciliter.
Okay, 2.5 milligdl.
Got it. But keeping that level right is, well, it's complicated. It's not just one thing. It's this intricate interaction between parathyroid hormone, PTH, vitamin D, the gut, bones, kidneys, even the parathyroid glands themselves.
Wow, okay. Lots of players involved.
Yeah, they're all constantly talking to each other to keep things, in balance.
So, if that balance is off and the levels are low, what's actually going wrong? What are the main ways this happens?
Generally, there are three main roads, three ways it goes wrong. First, phosphorus can actually shift out of the bloodstream and into the cells. That's called translocation.
Moving inside the cells. Okay.
Second, the kidneys might mess up. Normally, they hold on to phosphorus, but sometimes they start letting too much leak out into the urine. So increased loss.
Right, like a leaky faucet.
Exactly. And third, it could be an intake problem. The body just isn't absorbing enough phosphorus from food in the digestive tract.
So it's moving into cells, being lost by the kidneys, or not enough coming in, like a bank account, you said?
Yeah, like dodgy withdrawals, a leaky vault, or just not enough deposits, that kind of thing.
Okay, clear picture. Now, the source material really emphasizes that low phosphorus hits ATP production hard, that cellular energy currency, and that affects tissues that need a lot of energy. Why is that link so vital?
Yes, ATP, adenosine triphosphate. This is where it gets really crucial. Phosphorus is absolutely fundamental for making ATP. Think of ATP as the gasoline for every single cell.
Right, the power source.
Exactly. And some tissues are like gas guzzlers, skeletal muscle, heart muscle, nerves, even red blood cells. They have incredibly high energy demands.
Makes sense.
So when phosphorus is low, it's like their fuel line is getting pinched. They just can't function properly.
Right.
Hits them hardest and fastest.
Like a city power grid failing during peak demand, the essential services go down first.
That's a great analogy. Yeah.
The source also mentions several enzyme systems that need phosphorus. Can you give us a feel for why those are important?
Sure. Take glycolysis. That's, the first step in breaking down glucose for energy. Several key enzymes in that process need phosphorus.
Okay.
Then there's ammonogenesis in the kidneys, vital for handling acid waste, needs phosphorus too. Even activating vitamin D, which we need for calcium absorption, relies on phosphorus.
Wow, it's everywhere.
It really is. And one more red blood cell's needed to make something called 273-diphosphoglycerate.
Okay, 2-sulfonyl-3-DPG.
Yeah, 2-4-3-DPG. And that molecule is essential for helping hemoglobin release oxygen to the tissues. So low phosphorus can even mess with oxygen delivery. It's central to so much.
And it's not just about energy, is it? The material also mentioned cell membrane integrity.
Correct. Phosphorus isn't just for ATP. It's also needed to make other important molecules like GTP, MANT-P, phosphocreatinine. All these are vital for keeping cell membranes stable and functioning correctly.
Right, like the cell's internal structure and communication systems.
Kind of like the scaffolding and the wiring, yeah. Holds it together, lets it work.
It's got a heck of a job description, that's one element. Now, the source specifically flags diabetic animals as being at higher risk. What's the connection there? Why them?
Yeah, diabetes. That's a really key point. Diabetic animals are often, well, they're sort of set up for this problem through multiple routes. They might already have lower phosphorus stores to begin with.
Okay.
They can also lose muscle mass. And muscle is a big storage depot for phosphorus. Plus, their kidneys often don't work quite right, leading to more phosphorus lost in the urine.
So multiple hits already.
Exactly.
Yeah.
And then here's the kicker, the treatment itself, insulin, which is obviously essential.
Right.
It works by helping cells take up glucose. But that very process also pulls phosphorus into the cells along with the glucose. So treatment can actually lower the blood phosphorus levels even further, especially initially.
Wow. Okay, so treating the diabetes can actually worsen the hypophosphatemia, at least temporarily.
It can, yeah.
Yeah.
It really shows how interconnected everything is. Managing one thing means you've got to watch out for these other potential imbalances.
Okay, so we're getting the picture. We know what it is, how it can happen. But what does it actually look like in an animal? What are the consequences across different body systems?
The effects can be pretty widespread and honestly quite serious.
Hmm.
Let's start with the blood and immune system, hemoclymphatic immune.
Okay.
Low phosphorus can cause hemolysis, that's red blood cells breaking apart. Think of them like little oxygen delivery trucks just falling apart on the road.
Not good.
Definitely not. It impairs oxygen transport. We can also see issues with white blood cell function, fighting infection, and platelet function clotting.
So immune system and clotting affected too.
But interestingly, the really obvious signs of hemolysis, like pale gums or reddish urine, usually only show up when the phosphorus is severely low, like below 1.0 ml/GDL.
Ah, so it could be brewing under the surface before you see those dramatic signs.
Exactly. It might be happening before it's visibly obvious.
Crucial point. What about the nervous system, nerves and brain?
Well, the brain runs primarily on glucose, right?
Mhm.
And getting that glucose into the nerve cells efficiently requires phosphorus.
Okay, that energy link again.
Yeah. So low phosphorus can mess up glucose uptake in the brain. This can lead to encephalopathy, just general brain dysfunction, maybe seizures, and in really severe cases, even coma. It's like the brain's power is flickering.
Scary stuff.
Yeah.
And muscles. Given the ATP link, I assume they took a big hit.
Oh, absolutely. We can see something called rhabdomyolysis, that's muscle breakdown.
Right.
Leads to weakness, pain. And if the breathing muscles are affected, it can even lead to respiratory failure, needing ventilator support.
Wow.
And it's not just skeletal muscle. It can affect smooth muscle too, like in the gut, causing ileus where the intestines just stop moving properly. And the heart muscle itself can weaken, leading to poor contraction.
So it really is a system-wide problem. The source mentioned older animals and diabetics are more prone. Any other big risk?
Those are definitely key groups, yes.
Yeah.
And as we'll get into with the causes, anything leading to poor nutrition or problems absorbing nutrients can bump up the risk too.
Right.
Often, the history you get from the owner points towards the underlying cause. But those really severe signs, the anemia, the profound weakness, those are often directly tied to just how low that phosphorus level has dropped.
Okay, let's dive into those causes then. The source groups them nicely. First up, maldistribution or translocation that shift into cells. What triggers that?
Right, the phosphorus moving into cells. This happens pretty commonly during the treatment of DKA, diabetic ketoacidosis.
Ah, the diabetes connection again.
Exactly. But it can also happen just with giving insulin or even a bunch of carbohydrates. Also with total parenteral nutrition, PPN, where all nutrients are given IV.
Okay.
Or during recovery from starvation. That's called refeeding syndrome. Giving nutrients too quickly after starvation can cause this shift. And even, strangely, hyperventilation. The change in blood pH makes phosphorus move into cells.
Wow, quite a mix. Okay, second category, reduced renal reabsorption. What makes the kidneys waste phosphorus?
Several things can stop the kidneys from holding on to phosphorus, like they should. A big one is primary hyperparathyroidism, too much parathyroid hormone.
Right, the hormone that regulates calcium and phosphorus.
Precisely.
Yeah.
Also, certain kidney tubule disorders, like Fanconi syndrome, cause phosphorus loss. Some diuretics can do it too.
Okay.
And other conditions like eclampsia, that's severe low calcium after birth, or Cushing's disease, hyperadrenocorticism, even giving sodium bicarbonate can increase phosphorus loss in urine.
Lots of potential culprits there. Third category, reduced intestinal absorption. Just not getting enough in.
Yeah, pretty straightforward.
Yeah.
The diet itself might just be deficient in phosphorus. Or the animal could have a vitamin D deficiency. Vitamin D is crucial for absorbing phosphorus from the gut.
Right.
Any condition causing general malabsorption will do it too. And sometimes we actually give phosphate binders, medications to reduce phosphorus absorption, usually in kidney disease, but that can obviously lower levels too.
Makes sense. And the last category was a bit different lab error.
Yeah, it's always something to keep in mind. If the blood sample is hemolyzed, red cells broken, or if the animal is icteric, jaundiced,
Yellowish tinge.
yeah, high bilirubin, those can interfere with the test itself and give a falsely low reading. Certain drugs like mannitol can sometimes skew results too.
So you always have to interpret the number in context.
Absolutely. Is the sample okay? Does the number fit the clinical picture?
Right. So recapping the big risks then, who is most likely to run into this?
Okay, key risk factors. Definitely animals on phosphorus-low diets or IV nutrition that isn't properly balanced, especially that refeeding situation.
Mm,
Diabetes mellitus is a major one for all those reasons we discussed. Prolonged anorexia, starvation, malnutrition depletes stores, and primary hyperparathyroidism, messing with the regulation. Those are the big ones.
got it. So if a vet suspects hypophosphatemia based on signs or risk factors, how do they confirm it and figure out the why? What's the diagnostic approach?
It's a combination of things. History from the owner, a thorough physical exam, and then, crucially, lab tests. But you also have to think about other conditions that look similar, the differential diagnoses.
Right. What else could it be?
Exactly. Like if you have a diabetic animal, high blood sugar, ketones in the urine, DKA is top of the list. If you see sugar in the urine but blood sugar is normal, maybe along with kidney signs, you think about a renal tubule problem,
Okay.
high calcium. Points towards hyperparathyroidism. Low calcium might suggest hypocalcemic tetany. It's about matching the pattern of signs and lab results.
So the lab work is really directing you. What specific findings are most helpful beyond the low phosphorus itself?
Well, the low phosphorus, below 2.5 milligl is the starting point, obviously.
Mhm.
But yeah, the rest of the panel is key. High blood glucose, glucosuria, ketonuria, points to DKA. Glucosuria with normal blood glucose, maybe other signs like protein in the urine or azotemia, suggests kidney tubule issues. High calcium strongly suggests primary hyperparathyroidism. High alkaline phosphatase might fit with Cushing's. Low protein levels could indicate gut malabsorption.
It's like detective work, putting the clues together.
Very much so.
Are there more specialized tests beyond the standard bloods and urine imaging?
Yes, absolutely. Depending on what you suspect. Serum fructosamine helps confirm long-term high blood sugar and diabetes. A PTH assay measures parathyroid hormone, directly key for hyperparathyroidism.
Okay.
There's also PTH-RP, which you might run if you suspect high calcium caused by certain cancers. You can measure vitamin D levels if deficiency is suspected.
And imaging?
Imaging can help too. X-rays might show urinary stones, sometimes seen with hyperparathyroidism, or bone changes linked to vitamin D issues. An ultrasound of the neck is really useful for looking for an enlarged parathyroid gland.
Right, looking for that parathyroid tumor.
Exactly. And sometimes, rarely, you might need surgery to explore the neck, or specific urine tests like the urine-anion gap to pinpoint kidney tubule problems.
Okay, so a really thorough workup to nail down the cause. Now, the important part. Treatment. What can be done?
Well, prevention is always best, right? Balanced diet, managing underlying diseases like diabetes carefully.
Sure.
But when it happens, treatment depends on severity and cause. Mild cases where phosphorus is just a bit low and the animal feels okay might not need specific phosphorus added back.
Right.
If it's linked to insulin or IV feeding, just making sure enough phosphorus is in the fluids going forward might be enough.
But what about the really low levels, the severe cases?
Yeah, for severe hypophosphatemia, hospitalization is usually needed. Close monitoring is key, especially watching for signs of that red blood cell destruction, hemolysis.
Okay.
They'll typically get intravenous fluids, IV fluids, and it's critical these fluids should not contain calcium. Adding calcium when phosphorus is low can cause calcium phosphate to precipitate, which is dangerous.
Ah, right. Avoid calcium in the fluids.
Yes. Instead, the fluids are often supplemented with potassium phosphate. And if there's severe hemolysis causing bad anemia, a blood transfusion might be necessary.
What are the actual drugs used to boost the phosphorus?
The main ones are potassium phosphate and sometimes sodium phosphate, given intravenously. The dose has to be calculated really carefully based on weight and how low the phosphorus is, and it has to be given slowly, usually as a constant rate infusion over several hours.
Slow and steady.
Definitely. And you have to monitor the blood phosphorus levels frequently, like every 6 to 8 hours. The
Yeah.
goal is to get the level up toward the low end of normal, maybe around 2 milligdl, and then stop the supplementation,
Why stop there? Why not get it fully back to normal?
because you want to avoid overshooting. Giving too much can cause hyperphosphatemia, high phosphorus, which brings its own problems, including potentially causing calcium levels to drop dangerously low. So stop before you get too high.
Okay. Tricky balance. Are there times when giving phosphate is just too risky? Contraindications?
Yes, several. You definitely don't give it if phosphorus is already high or if calcium is low. Also, avoid if calcium is high or if the animal has significant kidney failure unless it's managed incredibly carefully. High potassium is another reason not to give potassium phosphate. And some specific IV fluids or drugs like the butamine are incompatible.
So lots to consider. Any other general precautions?
Yeah, be extra cautious if the animal is on certain diuretics. And if there's pre-existing kidney disease, you have to be very, very careful with dosing and monitoring. Also need to be aware of potential interactions with other drugs, like ACE inhibitors or certain heart meds.
Right. What about less severe cases or maybe longer-term support? Any other options besides IV?
If the animal isn't vomiting and can absorb things from their gut, oral phosphate supplements are an option. Might be used for milder cases or after the initial IV crisis is over. And interestingly, sometimes even giving milk skim or low fat can be used as a source of phosphorus in certain situations.
Milk. Okay. And ongoing monitoring sounds absolutely critical.
Oh, completely critical. Check phosphorus every 6-8 hours initially until stable. Watch for signs of going too high, hyperphosphatemia. Check potassium levels daily too, as phosphate and potassium can influence each other. It requires really close attention.
And finally, what happens if it's severe and isn't treated or treatment doesn't work? The potential complications.
They can be really severe, unfortunately.
Mhm.
Hemolysis, that red cell breakdown, is a major one. Respiratory depression or even failure due to muscle weakness is possible. And in the absolute worst cases, cardiac arrest can occur.
Wow. Okay. Well, this has certainly been a comprehensive deep dive. It's clear that hypophosphatemia, while maybe not the most common thing vets see, is definitely significant.
Absolutely. It stems from so many different potential issues, and the consequences can be serious if it's missed or not managed properly. It really drives home how essential phosphorus is for just basic bodily function.
And it really highlights the skill involved in diagnosing these complex electrolyte issues and figuring out the right treatment plan. Thanks so much for walking us through all that.
My pleasure. Understanding these underlying mechanisms, it really gives you a much deeper appreciation for just how intricate and interconnected
Right.
animal physiology is. It's fascinating stuff.
It really is. And that leads us to a final thought for you, the listener. Given this wide range of conditions, diabetes, kidney issues, nutrition, hormones that can all funnel down into this one specific electrolyte imbalance, hypophosphatemia, what other seemingly small or minor imbalances in the body might actually have unexpectedly large ripple effects? Something to think about. Join us next time for another deep dive.